I'm Patricia Thomas, and I am a physician who currently resides in South Jersey. Other than a doctor, the only thing I've ever wanted to be was a mom. So I am doing that too. I'm a full-time doctor and a full-time mom. I love helping people. It's what I've wanted to do my whole life. And it's very satisfying when you can, fix something, make somebody feel better, or even sometimes just give them peace of mind. I'm not treating the ailment, the condition, the illness or injury that the patient's there for. I'm treating the patient and the person. This time of year, we're seeing a lot of colds and flus, still seeing some COVID visits, strep throat, things like that. As the weather gets warmer, we see more injuries, especially, sports injuries and that type of stuff. Having a primary care doctor is extremely important and is urgent care should not ever replace your primary care doctor. Sure, we're there when you can't get into your primary care doctor, when you have a cold or, there is something that you need addressed. And obviously we can always refer you to a primary care doctor if you don't have one. Or, if we need to, reach out to your primary care doctor to help get an expedited appointment if necessary. But we should never replace your primary care doctor. The nice thing about having one system for all of Inspira, if they have a primary care doctor who's in Inspira, I can directly send a message through the EMR system, requesting something or letting the primary care doctor know, hey, this is what I saw the patient for. They need follow-up. Can you please make sure that this is followed up on? Probably the biggest misconception is that we're not an emergency room. And we're not a primary care doctor. So that, those are the big things that, people need to understand, and that you need to know what is urgent care appropriate and what's not urgent care appropriate. We can definitely handle minor emergencies, a small laceration that needs a few stitches, a minor broken bone, a cold, a flu, that type of stuff. But, serious things that, require admission to a hospital, surgery, things like that, that would be what you would go to emergency room for. I think it's important to have an urgent care in East Vineland. There's a lot of people in a small area, and there's limited amount of primary care doctors. So having urgent care there makes, it's more convenient for people, and it gives them the availability to still see a doctor when their primary care doctor is not available.